Welcome to pharmacology. This is your intro. This is easy. We're just going to ease into the pool here. Chapter 1, relatively short, 15 pages, but it's mostly figures, and the actual information that's in there is really straightforward and pretty easy. So you're not going to have, I just want to get us kind of thinking about some of the terminology and stuff around drugs and that kind of stuff. The book does define a drug. I'm not going to ask you these actual terms right here. We're just going to use them, right? So you should have been exposed to indication, contraindication. Now we're just applying that to drugs. We'll talk about, the book does talk about drugs from a treatment and prevention of disease aspect. We'll talk about all kinds of substances. We'll talk about recreational drugs and other substances that change physiology. We will talk about individual drugs. A lot of times we'll talk about the intended effects, and then we'll definitely talk about the different unintended effects and whether that's a side effect. Sometimes a side effect like drowsiness, sometimes that becomes the intended effect. If we're taking Benadryl, Tylenol PM has Benadryl in it to help you, to take advantage of the drowsiness. You take it to help you to kind of fall asleep sometimes. So the unintended effects sometimes kind of goes back and forth. The adverse, what makes an adverse effect is just the level of harm as we start to go through there. Hopefully it doesn't get to the poisoning or the toxic harmful effect as we go through there. And really, all drugs are poisons, right? When we talk about poisons, or all drugs can be toxic based on how much you take. It depends on the drug, and different drugs have different levels. Think about ibuprofen. It's going to take a lot of ibuprofen to get to a toxic level, or even a harmful level that we have. Contrast that with a narcotic pain reliever. That doesn't take that much, right? So if you're taking codeine for pain, it's not going to take as much of that to start to become adverse and even into that toxic realm as we go through there. This stuff is not in your book, but I did want to start to introduce some of this as terminology, because we will talk about specific sites and what the mechanism is. It may be a specific receptor site, or it may be a certain process in the body, like an enzymatic process that we're interrupting. And so that's what I want. I do want you to have an idea of what the mechanism of action and sites are. And then really, when the drug gets to that site, what does it do? Does it cause an action? Does it cause some kind of a physiologic change, which is an agonist? Or does it block it? Does it stop it? You guys have seen these terms agonist and antagonist before. Now we're just applying it to drug actions. So make sure that you have a kind of an idea. And you'll see that from time to time. When you see this is a specific agonist, that means it's going to start something as opposed to block something as we want. There is always competition for, if we have two substances that are going after the same receptor, there's competition, and sometimes we use that to our advantage, and both with multiple drugs going in, and we might have to worry about that, or substances that are already in the body that are trying to get at certain receptors, and then we put a drug in there that's going for the same receptor, and we know there's competition, and so anyway, that may kind of change the way that that drug is working. The book does talk a little bit about how we classify drugs, and I think that's important to at least just talk about. You can read the book and talk about some of those, some of the classifications that we are going to use. So we'll definitely talk about chemical structures or you don't have to know the chemical structures. You don't have to know that that's a cephalosporin. No, don't worry about that. But we will talk about cephalosporins as a class of antibiotics. Definitely corticosteroids as a type of anti-inflammatory medication. So as we go through there, then we have the mechanism of actions. That's a lot. That's probably the more common one that we will in this class at least is to classify drugs. Is this a COX-2 inhibitor, which is here's that physiologic process, that enzymatic process that goes through there, and if we inhibit it, this little piece right here, well, we don't make prostaglandins, and then we don't have as much anti or inflammatory type effects as we go through there. Then we have the two receptor. Do we have a beta? We have something that causes it, like a beta agonist, which is a bronchodilator. So it's going to cause something to dilate. Or are we stopping something? Are we blocking something? I put the histamine receptor. The picture is a selective serotonin reuptake inhibitor, so that we're just blocking the reuptake of our normal neurotransmitter. And then everybody has an idea of, hey, I'm taking an antibiotic, I'm taking a pain reliever, I'm taking an anti-inflammatory as a therapeutic, outcome of that. Most of you, and the book does talk about how we name drugs. Most of you have an idea of there's this concept of a generic and trade name. Generics are usually inexpensive or less expensive. And so you look at, if you're going to the Walgreens to get some Tylenol, you might just go, hey, I just need some acetaminophen, and you get the Walgreens brand because it's cheaper, but it's the same exact drug as Tylenol. It's the same exact dosing and that kind of stuff. So that concept, and as well as the concept of this prescription drug, that there's certain drugs you can't just go buy. You need a doctor to prescribe it. And then there's the over-the-counter level of drugs. And so as you look through there, the book does not talk about legislation. I thought it would be, important to note that a lot of the way we deal with drugs and talk about drugs has come from specific laws that have been enacted across the years. Specifically, the first one that created the FDA, that's kind of a big deal. A couple of important amendments, as you see there, that created the designation of what a prescription, what a over-the-counter drug is, and those categories. And then, it'd be probably a good idea to have companies test to make sure the drug is safe and to make sure that it does what we think it does. It actually stops, a certain thing or that kind of stuff. And then we had the two laws that were related to the packaging. We have our tamper-proof, lids here and containers, and that has crossed over to the over-the-counter stuff where you have to line up the little arrow, and that's, somebody was in the early 80s. We had a lot of people that were actually tampering with Tylenol and going in there and putting cyanide in Tylenol, and then people were dying. So, somebody always has to mess it up. The Controlled Substances Act is an important one, especially for us. So I do want, and this is in your book as well, I do want you to have an idea of, what the Controlled Substances Act is and really the schedule of drugs. And so you look at, I do want you to have an idea of Schedule 1 through 5, and then really the definition, right? And so I want you to know that if drugs that have no accepted medical use are Schedule 1, and then from then on, once we get into the group of drugs that have some kind of medical use, then we look at how much is there potential to abuse it and become addicted and that kind of stuff. So Schedule 2 through 5 is kind of that varying high, moderate, low, that kind of stuff. You don't necessarily have to know the refills and what's in them. You'll pick those up. You'll just kind of start to pick those up, that if we're talking about codeine as a narcotic pain reliever, that's a Schedule 2, and you can't just go back and get a bunch of refills because you need a prescription each time you get it refilled. The FDA does a lot of things, drug approval. I'll talk about that here in a second. Your book talks about that. But it creates all kinds of guidelines for how drugs are used in this country and substances are used in this country. And so the biggest one that I wanted to point out to, and I will probably ask you about this, is just, the guideline to pharmacists that if you're given a prescription for a drug and you go down to your Walgreens or wherever you take it, the pharmacist will give you the generic form of that drug because it's cheaper, right? So even if it's written in the, we want this kind of this specific drug, unless the doctor puts specifically only the trade name, if they don't do that, the pharmacist has been directed to give you the generic cheaper form because it's cheaper, right? The drug approval process, you can see that. This is in your book on page 11-ish, 10-ish, something like that. It's on page 10. The actual years here in this is not, I'm not going to ask you the specific years. This just gives you an idea that it takes a long time for a drug to go from brand new, I just created this, to full FDA approval. And so it takes a long time. The COVID-19 vaccines, we've just had experience. Those were basically created within a year. Within a year of COVID-19 being a thing, the FDA had given at least emergency authorization and people were getting vaccines. So that created a lot of anxiety and nervousness, like, hey, whoa, wait a minute, this is way too fast. You've skipped some steps here. Are they safe? So a couple things I want to say, and I think it is important. I will ask you this, because people will ask you this, and people will have their opinions of the COVID vaccines. But ultimately, this basic science and even preclinical testing already existed for vaccines. We already knew how to make a vaccine. Even the mRNA, the messenger RNA platform that Moderna and Pfizer uses, that was already in existence. So we already knew how to get things into cells, with these different ways. Then once we got a little piece of COVID-19 virus and we packaged it, then we needed to do the clinical trials. And so that was what was accelerated in here, is the phase 1, phase 2 trials were kind of shortened down to get this. And that's why the initial vaccines were only emergency use from the FDA. And then now, as we've gone through 2 and now in our 3rd year, now we finally got full FDA approval because we've had time, or the clinical trials have had time to play out and identify, are there some negative effects, or what are they, and that kind of stuff. And then once we do get FDA approval, there is continued monitoring and research that goes on to kind of, make sure that the efficacy is what we thought. And, specifically with COVID-19, it's not what we thought. If you think about the COVID-19 vaccine is not going to stop you from getting COVID. It's not going to prevent you from passing COVID, but it may. And that's kind of what we think now, is that it may limit the actual progression of the disease and the severity of symptoms and that kind of stuff. Does it do that? I don't know. And that's where you look at some of the ongoing clinical trials to see if it does do that. All right, here's the pregnancy rating. I'm not going to ask you those. I think it would be, it's interesting to note that certain drugs have an A through E rating kind of thing, and A's are better, and we have good information. A quick note, kind of personal story. My wife is an epileptic, has epilepsy, and is on a great anti-epileptic drug. She hasn't had a seizure, knock on wood, since she's been taking it. But that was before we had the 2 children. She got pregnant. So when it came to that point, it's like, what are we going to do? And so the drug that she took was a C-rated pregnancy drug, and basically it was rated C because there was not a lot of studies in humans yet that showed that it would work. But we made, in our conversation, the benefit of not having a seizure was paramount. We didn't want to have a seizure while the child was in the womb, and so we felt like it outweighed the potential risk of staying on that. And so the cool thing, the interesting part of that, is because there was a lack of human studies, my wife took part in a actual clinical monitoring study and had to answer some questions at various points through both pregnancies to make sure that are there any observed negative effects that are there. So just interesting to go through some of those situations as we go. All right. The final one, and your book doesn't talk about this yet, but I wanted to talk about it now. I'm going to go pretty quick, except on this slide, even quick on this slide. You need to know this slide, period. You need to know what dispensing is, multiple doses. You need to know what administration is, a single dose. And then you need to know what athletic trainers do. We can provide, legally, we can provide a single dose of medication to an adult, not a minor, but we cannot give multiple doses. So that's legally, that's what we can do. And so you need to know, I will definitely ask you about that. The rest of these slides, and you have these, I want you to look through there. You can read those and look at that. This is just guidelines for how athletic trainers should interact with medications and that kind of stuff. Hopefully we're doing this at TLU. Hopefully this is some of the same, you've come in contact with this a lot as we go through there, and how we travel with medications, how we get rid of, look at the expiration dates, all that kind of stuff. And when we do give medications, what do we do? How do we do that? Hopefully we only provide a single dose. And then are we just what kind of information are we tracking as we go through there. The book does talk about a number of drug information resources. There's a ton of them. You're not going to have to know this. I think you should know the physician's desk reference, or the PDR. This was the gold standard for a long time. As big as this looks in the picture, it was that big, if not bigger, and heavy before we had access to information on computers and phones and that kind of stuff. Man, phones are great, right? And so what I am going to ask you guys to do is get an app on your phone that you can easily and quickly access information on specific drugs. I am going to be a fan of, or I'm going to be the pitch man of Epocrates. It's free. It has a lot of good information, almost all the information that you could ever need. There may be some little things here and there, but from a functional standpoint, I see this as a app on your phone that you're going to keep and use as a professional. So get this. We'll use it in our class, but I think you'll use it as you go through, and it's a good app. This is the actual icon that I think what it looks like now. You might see this on iPhone. My icon looks like this now, but it's free, so it's good. All right, you've been introduced, and so I'm going to stop the video here. So we'll have fun. I hope it won't be that bad. I promise.